We might get started. Good morning, everybody. My name's Dr. May Rushil. I'm an epidemiologist and a senior research fellow at the Australian National University. I'm also on the board of directors for the Global Health Security Network. And so on behalf of GHSN, I'd like to welcome you all. I'd also like to pay my respects to the traditional owners of the land here in Canberra, where I am based, and Ngunnawal people, and pay my respects to elder past, present, and future. Now, today, it's my absolute pleasure to welcome Dr. Krithika Kupali, who is a clinician and a researcher. She's an assistant professor of medicine in the Division of Infectious Diseases at the Medical University of South Carolina, and an emerging leader in biosecurity fellow at the Johns Hopkins Center for Health Security. Now, Krithika has a lot of experience in infectious diseases emergency responses. She's been playing a very active role in the COVID-19 pandemic, serving as a subject matter expert in various fronts. But one of the key things that we want to talk to her about is about Ebola virus disease and Ebola outbreaks. Many of you might be aware that we've just 2 days ago, or a couple of days ago, WHO, a new outbreak of Ebola virus disease has been detected in Africa, both in Congo and in Guinea, with new cases being reported, as well as a few deaths as of yesterday. So it is a good timing in a way, and our best wishes to frontline responders in all of these settings. It is not an easy feat to be dealing with both Ebola and the COVID-19 pandemic. But Krithika was at the front line in West Africa in the 2014 Ebola outbreak, and where she helped lead the development and implementation of pandemic response preparedness in resource-limited settings. And she has a lot of frontline experience from that particular 2014 outbreak. So we'll be talking a lot to her about the 2014 outbreak, the Ebola outbreak experiences back then, what are the challenges of dealing with Ebola in the context of COVID-19. So, as a reminder, if you have any questions, please do put them in the Q&A section, and we'll try and get through as many as possible. Welcome, Krithika. Thank you for joining us today.
Hi, thanks for having me. Excited to be here.
And thank you. And maybe we can start by you telling us a little bit about yourself and how you ended up in Sierra Leone as part of the Ebola outbreak in 2014.
Sure, that's a great question. As you mentioned, I'm an infectious disease physician, and my interest had always been in global health. And when I was doing my infectious diseases fellowship, I was really lucky to have the opportunity to do some work overseas. And I spent a year doing research and HIV work in India. And it was actually at that time when I was doing work on HIV infected individuals, I got interested in emerging infections. I saw a lot of HIV patients who had diseases that I had never seen before, things like brucellosis and leptospirosis. So when I came back to the United States, I continued studying actually emerging infections in HIV infected individuals. And when I took my first faculty position, that was when I started hearing about the Ebola outbreak in West Africa. And so I'd kind of been tracking it, and as things got worse, and I began to hear of the need for having clinicians in various parts of West Africa. So as the calls came out, I put my name out there, and because I had that previous international experience, they asked me to come and work with them. So I went over there with Partners in Health, and actually I was supposed to go to Liberia, and about a week before, they switched me over to going to Sierra Leone. And I was actually a little bit disappointed at first, because I thought I was going to be going somewhere where there was not really much action, and ended up landing in Sierra Leone right as everything shifted. So right as cases starting to peak in Sierra Leone is when I got there. And where I was in Sierra Leone was in Port Loko district. And we had we had the second most cases in the country over there. So we were quite needed. And I think I was probably in like the second group of people that ended up over there. So when I got there, the ETU that we were running was full, And then I got asked to go over and help run the Ebola treatment unit in the government hospital, which was full of patients as well. So it was definitely an unexpected experience, but one that taught me a lot.
Yeah, it's always quite interesting when you find your feet in a complex setting. Can you tell us a little bit about what actually it was like to be running an emergency treatment unit? What exact roles did you have? What were the other what other roles were being played in that? What were the critical skills and activities happening in an Ebola treatment unit at the time? And what was it all like? I'm sure our listeners want to hear a little bit about your clinical experiences of working with a highly fatal pathogen.
Sure. So I think, first and foremost, I didn't really know what to expect when I got there, and it wasn't at all what I expected it to be like. So yes, there were a lot of patients, but it wasn't like what you see on TV, right? So you don't have patients with bleeding from all their orifices or anything like that. But there were a lot of patients. I think you also have to remember that this is in a resource limited setting. And so, and like that, we didn't have a lot of resources. Back in 2013, the standard of care for treating a patient with Ebola was pushing oral rehydration salts. At that point, the debate was still about whether or not we put IVs in these patients. And so we didn't really have many resources to treat our patients with. So we would do daily rounds on patients, and we would give them, oral rehydration salts, malaria medications, multivitamins, and maybe some antibiotics. So there wasn't much that we could do for them. And I think the hardest thing a lot of the times was that feeling of helplessness that we had for patients who were sick, not really being able to do much for them. In terms of working in a unit with all these patients, I think the hardest part was being in full PPE and maybe not actually being able to connect with them. These patients who were very sick, and knowing that you had to keep your physical distance from them, so you couldn't touch them, you couldn't show that human connection with them. That I think was really hard for me, at least. And also, it was just very physically grueling for anyone who's been to West Africa. Very hot, very humid. So being in the PPE itself was, at times very difficult. I think that there's just a lot of stories like that, at least for me. I have a lot of pictures in my mind that are still there of patients that I took care of in those difficult circumstances, dealing with the difficult infection control measures that we had to deal with, the patients, and just overall the difficult circumstances, not having enough resources, not having laboratory testing capacity, at times not having enough PPE, all those things were very difficult. And so it was very much a learning on the ground type of experience.
Yeah, you're absolutely right. And, we've learned a lot in the last 5 years on how to respond to big outbreaks and emerging infectious diseases. And of course, we've landed ourselves in the COVID-19 pandemic. So where, in the current context, moving on to, I guess, the present climate, where do you think are the biggest challenges, and what lessons do you think we as a community can learn in health security space about how do we respond to Ebola outbreaks better in the future, or now as we speak, as of this week, but also what would be the key considerations in the context of COVID-19 for those on the front line or those working in public health roles and policy roles? Where do you think are the big takeaways or immediate implementation lessons, in fact?
Yeah, so I think one of the most important things is, and not just for Ebola, for COVID and for any sort of infectious diseases outbreak, is the importance of community engagement, right? And not just a top-down type of approach, but a really important grassroots type of community engagement. You really need to have the community feel empowered and really understand what is going on. And that's by and also engaging local leaders. So in West Africa, I would have said, you know, it was the village leaders and those in the local community that can help bring the rest of the community on board with what's going on. There were a lot of misinformation that was being perpetuated about Ebola, about the Ebola treatment units, that also has happened in DRC in the 2018 North Kivu outbreak. And that's not unlike what we've seen here with COVID, right? There's been a lot of misinformation that's been perpetuated about the COVID pandemic, about you know, people saying, oh, it's just like the flu, or information about masks and things like that. And so it's really important to have a strong community engagement. And again, there's lots of ways to do that by having people on the local level work as advocates, athletes, reporters, media, all sorts of different ways to do that. I think the other really important thing is really having people that can help combat misinformation too, right? Whenever there's these outbreaks, there's a lot of misinformation, and that can be almost as important, or if not more important than trying to engage communities, because trying to get ahead of that wrong information is really important. I also think that having a swift outbreak response is really important, right? So one of the problems in West Africa was that the outbreak response lagged a little bit, which allowed the outbreak to get out of control. And so I think one of the things we're seeing here now with Guinea and also in DRC is that you're seeing very swift outbreak responses to try and get the infection under control.
Yeah, of course. And we've come a long way that we now have a vaccine for Ebola virus disease, which we didn't have 5 years ago. So we've again come a long way, and it's a tool in controlling of outbreak. But of course, we know that vaccine alone isn't sufficient to control any outbreak for that matter. It comes with a package deal of several public health responses. But I'm really keen to, I guess, delve a little bit more on the community engagement side of things, and keen to hear from you about maybe, you know, we talk a lot about community engagement, but for our listeners, it'll be really great to kind of hear about an example or a story you might have, especially what role as a clinician who is working in an Ebola treatment unit might have, because were you going out to the communities and communicating with people in the community yourself or through others, or what were some of the, maybe a story where it worked, where it didn't work, you might be able to share for our listeners? That would be, I think, quite useful for people to know.
Sure. I think, so I was working at our ETU in the hospital. So, but I did take some field, from field trips out to some of our local, what we called community care centers. And these were very small centers located in rural parts of the district. And we would go out there and try to learn about kind of what they were dealing with and what they were seeing, and also talk to them about, you know, some of the symptoms that they should be aware of and some of the patient presentations that they should be aware of, and, you know, talk to them about their concerns and understand some of the things that they were worried about. And that, at least from my standpoint, as someone who was trying to help run the clinical management part of things, I think was really important. And I, you know, and especially in these rural areas, one of the biggest concerns they had was, you know, having adequate access to PPE, you know, so they could protect themselves. And so I think it's really important to understand the concerns that the people who were in these other areas, some of the things that they were worried about, so you can also help address those issues. I know that I worked with, you know, some of our other partners, so that WHO, CDC, a World Food Program, right? So all these different agencies were also very much involved in community engagement. And some of our CDC partners, they would go out into the field and they would be involved with like local villages and, you know, be talking to them about Ebola and talking to them about the signs and symptoms of Ebola. And they also worked very closely with trying to help reintroduce survivors into the villages, right? And so one of the ways that we did that was by having the village leaders try and reintroduce survivors into the villages, because there was a lot of stigma around that, right? So there were so many different groups of people working to try and do different things to try and help with that community engagement on various different levels.
Yeah, really, really good example. And also highlighting the role of different agencies and several partners. Like it's so many people work in the context of an emergency that it really, everyone's got a role to play, and you've got to come together quite effectively, whether it's UN agencies, organizations like the CDC, and non-government and non-profit organizations. And so and then moving a little bit, I can see, and so we might jump into a couple of questions that have come before we move on to some of the other topics, is Javier's asked us about, from an information perspective, what lessons can we apply from the Ebola outbreak with this so-called infodemic when it comes to anti-vaccine groups or anti-mask ideas? How do you cope with this challenge?
I'm sorry, can you repeat that one more time?
Yeah, no, absolutely. So I guess what are the key lessons in managing misinformation from the 2014 experiences, Ebola outbreak experiences, that you think relate directly to managing or addressing hesitancy and misinformation in the current climate of COVID-19? Any tools and tips that you've picked up over the course of time?
Yeah, well, I think one of the challenges with COVID-19 is that we have a lot more people using social media these days that we didn't necessarily have back in the Ebola outbreak back in 2013. And I think that's a good thing and that's a challenge, right? I think it's really, really important for people who are trying to handle misinformation. It's really important to stick to, basic information points, talking points, right? And also don't perpetuate the misinformation. So if you're on social media or something like that, and you see somebody tweeting or posting about misinformation, I wouldn't repost that information and say, here's why this is wrong. I try to always stick to the facts. And I think it's really important to stick to the facts. And, just for myself, when I am working with patients and talking to them about, and I get asked about all these myths all the time, again, I think it's just citing the evidence and being very straightforward about the information, and don't give it to them in big chunks. Again, give them, try and break it down as simple as possible. And I think that's all you can do is keep reiterating the facts. And, there's a lot of good infographics out there and things like that can be helpful. Again, like we see with COVID and like we saw with Ebola, there's infographics everywhere about Ebola, like that you see with like the signs and symptoms of Ebola. And we see that with COVID too, right? There's pictographics everywhere that have those things. And I think that's really the best way to try and dispel the myths that are out there.
Yeah, great. Really, really important. So let's go back to a little bit about the current Ebola outbreak. What are your key concerns, or maybe no concerns? Do you think we're well set up to respond to this in the COVID-19 pandemic? What are your thoughts on the current outbreak?
Yeah, so I think, there's concerns. The two different ones bring up a couple of different concerns. So I guess let's first start with the DRC outbreak. So the DRC outbreak is occurring in the North Kivu region. And for people who aren't familiar with that part of DRC, it's an area of DRC that has been heavily plagued with insecurity. So, and that was one of the challenges that they had in 2018 when the outbreak occurred there in terms of getting it under control. So I think the security issues make that outbreak challenging. I think the other concern, particularly with this outbreak, is that the initial patient that was identified as having Ebola and who passed away was the wife of a survivor. And I believe that this morning it was confirmed that this her virus looks like it's related to the 2018 outbreak. And so the reason that that's concerning is, again, she was married to a survivor. Reports are that his semen tested negative as recently as November. So, in terms of trying to understand the transmission dynamics of Ebola, that is concerning. So trying to understand, how did she get Ebola? How was it transmitted? So there are a lot of questions to try and understand. And because she was the wife of a survivor, she should have gotten vaccinated during the outbreak, because she would have been in that group of people that would have been vaccinated. So trying to also understand, was she vaccinated back in 2018 when her husband was infected? So I think there are a lot of questions that we still don't have clarity upon. And then again, like I said, the security situation in DRC is concerning. And then I guess if we shift to the Guinea outbreak, the West African outbreak very much decimated West Africa, and it's only been 5 years. And 5 years is not enough time to try and recover from this kind of outbreak. This is an outbreak that will take decades to recover from. When you think about the public health impact, the mental health impact, the economic impact that the West Africa outbreak had on Guinea, Sierra Leone, Liberia, and also just the impact that it had on the healthcare infrastructure of that country. So I worry, from that standpoint. I do believe that, they have obviously a better capacity to respond than they did back in 2013. That being said, both DRC and Guinea are trying to combat the Ebola outbreak in the backdrop of COVID-19, and that is going to be very challenging. I am encouraged that DRC has already started vaccinating contacts. Guinea is working on getting vaccine to vaccinate contacts, but the outbreak in Guinea is also on the southern part of Guinea, and that is at the border of both Sierra Leone and Liberia. And that is also concerning because this area has very mobile populations. And that was one of the reasons that the outbreak spread as quickly as it did last time as well. So there are a lot of challenges. As Dr. Shiel mentioned, we have actually 2 vaccines now. We have the Merck vaccine and the J&J vaccine, and those are reasons to be hopeful. We also have a therapeutic now as well to help treat people who have Ebola, and that's a reason to be hopeful. But there are definitely a lot of challenges to be concerned about.
Yeah, absolutely. And really, really good points. I think both around, I guess, public health response and identifying the source of infection, especially like you said, for the one in Congo, until we know. And COVID has taught us that finding people are much more aware of contact tracing and the idea of looking at exposures and finding source. And we all acknowledge and know that it's no mean task, and it's not a simple task to identify how a person may have contracted the virus with a complicated history. And of course, being able to respond in a timely manner, as you've highlighted, is really important. But let's talk a little bit about vaccines. And I know that you have a particular interest in new vaccines and therapeutics in the context of emergencies. I do too. So let's spend a little bit time talking about that. Do you want to tell us a little bit about, I guess, your thoughts around the vaccine for Ebola virus disease, and what do we know about them? So you said there's 2 vaccines. What do we know about them? Do we know which groups are getting vaccinated? Do we know how long are these vaccines known to be effective? Because we haven't had them for that long. So I think a little bit around what you know about these 2 vaccines would be helpful.
Yeah, so there's 2 vaccines. There's the Merck vaccine and the J&J vaccine. The Merck vaccine is a 1-dose vaccine. The J&J vaccine is a 2-dose vaccine. The Merck vaccine is the one that they've used mostly, and that's been FDA approved. There's a stockpile actually that has been developed, and so this is the first time they are using that stockpile, the vaccine. Like I said, they started vaccinating people yesterday in DRC, and then they are in the process of sending the vaccine to Guinea. I think one thing that's really important for people to remember is that this vaccine is only effective against Zaire Ebola virus, so not the other strains of Ebola. And both outbreaks have been confirmed to be Zaire. I think, so one of the things that's important is that these vaccines have been used as a ring vaccination. And so a ring vaccination is when you start vaccinating contacts of the cases, right? So let's say I'm a case, in a known case, let's say. So what you would do is you would vaccinate people who are my contacts to prevent them from getting sick, right? So, and that's a challenge, right? Because you need to figure out who those contacts are, find them, and vaccinate them. So that is a very difficult public health challenge. Again, you need manpower, you need people to try and find these people. You need, people who are not familiar with the terrain, that it's difficult terrain to try and navigate as well, right? So these are all very challenging things to do, and trying to figure out how far out to vaccinate contacts can be difficult too, right? Do you just vaccinate my contact, or do you vaccinate contacts of my contacts as well? So I have not read how far out they're going. I'm not sure how far out they're going right now, but that's what the vaccine ring is.
Yeah, great. And that's such an important tool. We saw the launch of ring vaccination in smallpox eradication, and it was how ultimately smallpox was eradicated. And it was really designed to optimize vaccine doses when globally vaccine doses were running out. And it's been used phenomenally for Ebola virus outbreaks. And hopefully in the future, we can optimize these strategies more. And Kotika, do we know about how long the vaccine lasts? Do we have a sense of how long the vaccine is effective?
I don't know the answer to that. And I think that is one of the questions we are having, because I think one of the other things, I didn't get into this earlier, but if you think back to the 2013 outbreak, they actually did conduct some of the early parts of the Merck vaccine trials in Guinea and Sierra Leone. And so, and this new outbreak is occurring in the part of Guinea where some of those vaccine trials are. So, one of the questions I've been wondering is, could the fact that some of these vaccine trials occurred there actually be helpful now? But I don't know how long the vaccine is protective for. And again, the other question coming up is the index case in DRC that passed away. Was she vaccinated? So I don't know the answers to those questions, though.
Yeah, and I'm sure we'll find out soon enough. But of course, we understand that it takes a long time to learn whether how long a new vaccine is protective and how long does the antibody last and a person's protective. So we will wait to learn. And so, and you talked a little bit about the therapeutic side of treating Ebola virus patients as well. Can you tell us a little bit more about what this new therapeutic is and what is its place in the outbreak response now?
Sure. So I know that in the 2018, so actually let's go back to the 2013 Ebola outbreak. So they, the PREVAIL-2 study, they looked at a monoclonal antibody cocktail called ZMapp, and it was shown to have some efficacy. At that time, they also started developing some other therapeutics, one drug called remdesivir that I'm sure many people are familiar with now, that we've all come to love for COVID. But I think it's important to talk about remdesivir because I think it's a great example of a drug that was developed, for Ebola, which was ultimately shown not to be beneficial for Ebola, but then was repurposed and has been gone on to show that it is useful in some sense for COVID-19. And I think the development and clinical trials and all that of therapeutics during outbreaks is very important because if they had never gone on to work on developing remdesivir, we would not have had it for COVID-19. So moving on from the 2013 Ebola outbreak, you then come into the 2018 DRC outbreak, which is the largest Ebola outbreak in DRC that has occurred to date. And you have the 4-arm PALM trial, which looks at ZMapp, remdesivir, the Regeneron antibody cocktail, and MAB-114. And what that trial shows is that MAB-114 and the Regeneron cocktail look to be efficacious in helping treat people who have Ebola, along with optimized standard of care. And so that was really an innovative study because it was really one of the first times that a randomized controlled trial had been done in the setting of an outbreak. And they did a really great job with the study. And again, showing that these two antibody cocktails can be given and can be shown to be beneficial when given with optimized standard of care in the setting of Ebola.
Yeah, great. Yeah, and it takes us into an interesting point. You said that, we developed a drug for Ebola. We've used it in trial settings to see whether it's effective against COVID-19, which really highlights the role of R&D and exploring new drugs, new therapeutics in the context of outbreaks, but also maintaining a bank. So I guess, what are your experiences and thoughts on that, about this repurposing of drugs for different diseases and our ability to tap on existing resources? You also made a point about that this is the first time we have a stockpile for an Ebola vaccine. So where do you think, what was done well for this from an R&D perspective over the course of last 5 years, and what can we do better in this space?
Well, I think the thing that was done well, again, was that after the 2013 outbreak, right, we continued to develop these drugs, right? We continued the development of the drugs, we continued the development of the vaccines. And when the outbreaks hit in DRC, we were on top of it. We were able to get the RCT done. We were able to get people vaccinated. That being said, I think things like CEPI and Gavi are extremely important to the development of vaccines, particularly CEPI, because we need to continue to develop vaccines for the next generation of emerging infections that are going to occur. Things like, we talk about Nipah virus or that are going to occur, we know that are out there, right? So we need to take a more proactive approach to the diseases that we know that are going to emerge. And I think that's really important. And so looking at molecules that have already been developed that could be potentially repurposed against some of these diseases, continue to develop these innovative platforms, right? The mRNA platform that has been leveraged for both the Pfizer-BioNTech and Moderna vaccines, that's a platform that had been being worked on for over 30 years, right? And so now we have this new platform that has been shown to be successful, looking at how we can continue to leverage this to develop additional vaccines. I think these are all very important things, but we can't stop. We need to continue to work on being innovative and continuing to think about how we can develop additional vaccines, additional therapeutics, because there will be another pandemic, there will be another infectious disease outbreak. We don't know when, we don't know where, but we need to improve our ability to pivot and perform these clinical trials as needed.
Yeah, absolutely. And for our listeners who may not know what CEPI is, it stands for Coalition for Epidemic Preparedness and Innovation. And they are spearheading globally the development of new biologics, drugs, and vaccines, therapeutics for emerging infectious diseases, especially in the context of pandemics, and have played a pivotal role in the launch or introduction of the COVID-19 vaccine through COVAX facility in partnership with Gavi and the WHO and other agencies. And so we might take one last question, talk a little bit more about vaccination, and then come into pandemic preparedness, which is a very big role for the Global Health Security Network as a whole. So one of our online viewers has asked us, what are your thoughts on the impact of impact that COVID-19 has on vaccination programs as a whole, and investment in dealing with other outbreaks, not just Ebola, but measles, tuberculosis, etc. So any thoughts of what COVID has done to these vaccination programs, and how do we make our investment more optimal?
Yeah, I think one of the unfortunate repercussions of the COVID outbreak or pandemic has been its impact on vaccine preventable diseases, right? So we know that vaccine immunization programs have had to stop or been halted or delayed in many countries, right? We've seen that happen with polio, we've seen that happen, we've seen cases of diphtheria emerge in certain places. We've seen measles cases emerge. And so I think that has been definitely the unfortunate downstream effect of the COVID pandemic. And, I think one of the things, as we try and roll out COVID vaccine all over the world, is trying to think how we can build better or more sustainable vaccine programs for all these different countries. So again, when another infectious diseases outbreak occurs, we can not have it be so, I'm trying to think of the right word, paralyzed, so to speak, by an outbreak, because you're absolutely right? We've seen, and not just vaccine preventable diseases, but so many diseases, infectious diseases affected, right? People with HIV who can't get their medications, people with TB who can't get their medications. We've seen an increase in the number of cases of TB, emergence of multi-drug resistant organisms. So it's really affected the whole gamut of infectious diseases, and that's quite unfortunate.
Yeah, absolutely. And it really highlights the need for us to strengthen health systems, ensure our workforce is trained and has sufficient PPE so they're protected so they can deliver health services. And we've definitely seen health services get disrupted, not just for infectious diseases, as you said, but also for non-communicable diseases, mental health impacts. And we really need to start taking a health systems approach to it. Now, let's talk a little bit about pandemic responses and our efforts at, I guess, strengthening our ability to respond. But one of our listeners had initially asked was, how well did the coordination work between agencies that you were talking about earlier in the 2014 outbreak? What are your reflections since then, and what were the key lessons, and where do you think we are now?
So honestly, I would have to say that I think our coordination was quite good in 2013. So every district had an Ebola response command center, and we would meet every night, and it would be all the partners in the district. And so in Sierra Leone, the response was run by the UK. So the military and the police from the UK. I believe it was the same in Liberia, but it was run by the US. So I can't speak for Liberia, but I felt like it was run very well. You would have all the partners get together. So you would have WHO, CDC, UN, World Food Program, those of us who were, running the Ebola treatment units, and we would, and all these other partners I can't honestly remember anymore, but we would, give our daily reports, and we would talk, we knew how many new cases there were in the district. We knew how many deaths there were. We knew what the epidemiology looked like. We knew how many people had died. We knew how many burial plots we had. We really knew the fine details. And then that information was taken up to the National Ebola Response Command Center. So I felt like the coordination, at least from my perspective, was quite good. I think again, it was the military running it. So I think there's a lot of things that you can learn in an emergency from the military.
Yeah, and it really highlights the role of military and security in command and coordination aspects of it. And so our next question is around COVID-19 has shown us that we were ill prepared for this particular pandemic, even after dealing with the Ebola virus. So what can we do to better develop our plans or programs for future pandemic preparedness and response? So where to from here? What are the key things that we need to learn and embed into our pandemic preparedness?
Well, so first off, I think that depends on where you are, first of all, right? So I can talk about the U.S. response, which, I think ultimately, right, you have to invest in pandemic preparedness, right? You have to have surveillance systems. You have to have the ability to, you have to have, quite frankly, you have to have a government that wants to invest in this. I think the example that I think about a lot is South Korea and what happened with MERS, right? So after the MERS outbreak, the South Korean government invested a lot of money in building up their public health infrastructure. They built up their surveillance systems, their ability to do contact tracing, the ability to do testing, and they drilled for it, right? They, in fact, had a drill on a coronavirus outbreak. I believe it was in December, before the SARS-CoV-2 outbreak was announced, right? So you have to have a government that believes in investing in pandemic preparedness and pandemic response. And, again, I think there's certain countries who've done this better than others. And I can speak to, at least in the United States, that, we have a short attention span. When something is happening, we say, okay, yes, we're going to do it. But then after the fact, we haven't done it. And so we really need to have a government that says, okay, we're going to invest in it. And that means all the things that I've said. We need to invest in, being able to scale up testing. We need to invest in contact tracing. We need to be able to invest in surveillance systems. We need to be able to invest in genetic sequencing, all these things that are going to be important. We need to be able to invest in having a stockpile of PPE. We need to be able to invest in preparing our healthcare systems. So these are all going to be very important things that we're going to have to do.
Yeah, absolutely. Investing at the right time is really important. Lessons learned are really important, and embedding them. And on that note, as a public health epidemiologist and infectious disease epidemiologist, I will take note to plug about the role of after action reviews. So if you are in contexts of where these tools will be valuable, I would encourage people to undertake after action reviews and interaction reviews so we can get better at responding to these outbreaks and pandemics and really embed that into preparedness plans. Now, one of the questions that we've just received is around, again, going back to vaccination. And so our audience has asked, they haven't experienced Ebola cases in Pakistan, maybe a couple in 2014, but they wanted to ask if it is possible to have Ebola virus disease in Pakistan, what are the types of precautions measures they can take in a context like Pakistan? So any thoughts on that?
The question about what precautions to take for Ebola virus in Pakistan?
Yeah, I guess if a case was to be detected in Pakistan, how would they quickly respond to that?
I mean, I think the way to quickly respond to it would be, first off, you want to isolate the patient, right? Anytime you have a patient that you suspect might have a viral hemorrhagic fever, that would be the first step. The second step would be to send the sample off to get tested. And then the third step, it would be making sure you have the highest level of PPE for the healthcare provider who is going to be interacting with the patient and to interact with the patient. So, right, that's going to be a N95 mask, a coverall for your head, face and eye protection, and a coverall, right? So you're going to want to make sure you have all that, and gloves. And then you would want to contact trace the patient, right, to see who they've come in contact with and make sure those patients are self-isolated. I'm not sure if that answers your question. Hopefully that does.
Yeah, I think it does. I believe it does. I think the idea is that I think understanding the transmission and the origins of the virus is important. And we know that this is a particular virus that mostly circulates in the sub-Saharan African region. But we also, I guess the most important thing is that if there is an exported case to another part, and because there is human-to-human transmission, we have to be thinking about how do we detect this case early, like we would with any outbreak-prone disease, and respond in a timely manner. Now, I'm talking about, again, pandemic preparedness and the roles different people and different areas of workforce have. And going back to a topic that is really important in all contexts of responding to outbreaks, of community engagement. Did you come across anthropologists and their role? Any experiences of working closely with anthropologists that you might be able to share with our listeners?
Unfortunately, I have not had the experience of working with anthropologists. I've wanted to, but I have not in the field so much. More in my younger days, I guess, when I was in my fellowship, but not so much in the field. I have not had that opportunity.
Yeah, but we do know that anthropologists play a critical role in really understanding the root causes of problems in a cultural context and how we can improve that from a social sciences perspective and improve our ability to engage communities and increasingly, I suppose they've always played a role in the health sector, but increasingly we're starting to acknowledge them and bring them to the core business of emergency responses, which is really, really important. And so another question is, since COVID-19 is obviously a global issue, what is your opinion about the proper way to get equity distribution of available and approved vaccines? Do you think COVAX is enough?
Oh, that's a hot button topic. Do I think COVAX is enough? I think COVAX is a great start. I think that really we need every single country to understand that until we have everybody vaccinated, we're not going to be safe. And that's not just lip service. They really need to understand that and get it and pledge to that, right? And I would really like to see all resource-rich countries make a commitment to that, right? So I think COVAX is a great start, but I think that again we need to see all the resource-rich countries really make a strong commitment towards doing that. And I think part of that actually would come from citizens of those countries trying to get their governments to make a commitment to that, right? So governments are going to do what their citizens tell them to do. So if we could get citizens to actually push for that, then I think that we would get our governments to do that. I do think that I do think that COVAX is a great start, but unfortunately, I think we do need more.
Yeah, and a lot of work to be done in this space. Now, I'm mindful of the time is quickly running out, but in the last few minutes, I'd be keen to hear from you about if you were to go back and respond to the Ebola outbreak now, say this week, what would be the key things that you as a clinician, as a frontline responder would do differently from when you were back there 5 years ago?
Wow. I think that if I were to go this time, I would probably actually, this sounds a little cheesy, but I would actually probably try to document my experience by writing about it. I think that one of the things that I wish that I had done is that I had done a better job trying to remember it. When you're in the moment, every day while I was there felt like a year, but then when I left, it was almost like I had a hard time remembering everything. So I wish that I could remember more about the experiences for myself. And I think that probably what I would do differently would be to try and just, I think, more be in the moment there, right? Try to not, I think when you're there, sometimes it's hard to not get yourself worked up at times because of the difficulty of the situation. And I think I would try to just be more in the moment and take, roll with the punches a little bit more.
Yeah, it's a humbling and nimble space to be in, absolutely. So we have another question around, you talked a little bit about the command and control experience in Sierra Leone and the role military was playing. And so can you reflect a little bit about the involvement of military in the 2014 outbreak and how things may have changed with the DRC outbreak more recently? So the role of security sector and military in your experience.
Well, I wasn't in DRC, so I think that might be a little bit difficult for me to discuss. So, and in DRC, we didn't, there was no external military in DRC, right? So they never sent in other troops there. Whereas, as I mentioned, in West Africa, the US and UK sent in their military to help. So that may have that obviously did make a difference. I think, again, like I mentioned in DRC, the very big challenge in DRC was the insecurity. So much so that, it was very difficult to send even external humanitarian aid workers into DRC because there was such a grave risk to their well-being. And I don't know if people are aware of this, but there was a WHO worker that was killed in DRC. So that's not a very good answer, sorry.
But what about, and maybe you could reflect a little bit more about your experience in Sierra Leone. Was military playing a critical role there in that outbreak, or what was their role in the?
Yeah, I think they were just the military was helping to kind of help run things, right? They weren't involved in taking care of patients or anything like that. They were just kind of helping with the incident command structure of the outbreak and trying to help kind of keep things in order. My interaction with the military was, very minimal. Like I said, they kind of helped with the reporting structure and things like that. And I worked with them in that capacity. But otherwise, I didn't interact with them that much.
Yeah. And so let's move from Ebola to your current area of work in the COVID-19 pandemic. And you've been working a lot in the US on COVID-19. Can you tell us a little bit about your work in working as a subject matter expert at the Department of Health and providing, how do you work with policymakers and departments of health as a external stakeholder, some of your work over there, and share your experiences of working in that space in the COVID-19 pandemic in the US?
Yeah, I think that that work is really important, right? I think that for many people, it's their first time working on an infectious disease outbreak. And so having had that experience, the experiences that I've had, and also just being an infectious diseases physician, we definitely bring a unique skill set in the way that we think about things and the way that we view things. And so I think it's been a really interesting experience with the Department of Health. I helped set up a field hospital for them to help deal with COVID patients. And then in terms of some of the different policy things that I've worked on, I helped with setting up guidelines for safe voting during the pandemic. And that was really important for our country, given all the challenges when it came around the election. So I think that helping to work with these different groups of people also has been really important. It's opened up a whole different level of collaborations that I never thought that I would have either. And I think it's really important to see all the different ways that infectious disease physicians can be helpful during this time.
Yeah, and so maybe I, as a last question, and then we'll hear your final thoughts, a little bit around for our listeners about setting up a field hospital in the US. What does that involve? Tell us a little bit about the field hospital that you helped set up, and how is it different to an emergency treatment unit that was in the field when you were in Sierra Leone for the West African Ebola outbreak?
Yeah, so setting up a field hospital in the United States is much more complicated than setting up a field hospital in West Africa. Much more bureaucracy, much more meetings, much more regulations. It was quite challenging in terms of how long it took. And again, it was like essentially like I was building a real hospital from the ground up. And I think that, again, it's very difficult for, I think, people here to wrap their mind around what an emergency situation is. And so whereas my mind thinking of what an emergency situation is, having had the experiences that I had, is very different, right? And so sometimes that could be a little bit challenging. I would prefer to do it in West Africa or in Africa than I probably would here in the United States, just given, again, I think there's a different set of expectations for something like that. Whereas when you need a field hospital, you just need to get it up and going.
Yeah, and I think one thing we should acknowledge and is important is that there has been a lot of development and capacity building and ability to detect early and respond early in many parts of Africa, and they are really true experts of dealing with outbreaks in a timely manner, which we have seen reflect well in the COVID-19 outbreak, where of course there's limitations of surveillance, but we know that countries as a whole have done quite tremendously well in many parts of Africa and many parts of this region in Asian countries and the Pacific as well. And I guess we're almost 2 minutes short, but we would like to just say any final thoughts about what's in the next 3 months for you from a COVID-19 pandemic? What do you think are the priorities for COVID-19 response in the US in the next 3 months?
Yeah, I think the next 3 months are going to be about vaccines and variants. I think those are the two big things, right? So trying to get the vaccine pushed out here, just like we are in many other countries, and then trying to control the variants. So I think those will be the two major things, and that'll be really it. And hopefully we can get it, circulating amounts of virus under better control.
Yeah, absolutely. And it's a humbling note to end this webinar on that this year is going to be about vaccine rollout and managing the pandemic better and monitoring our variants, because this is not over yet and we've still got a long way to go. But I really, on behalf of the Global Health Security Network, I'd really like to thank you for your time, Krithika, and thank you to our listeners. Please, the video for this particular webinar will be available online. And if you have any follow-up questions, please feel free to reach out to the network. Thank you again, Krithika, for your time and for sharing your experiences.
Thank you for having me.
Pleasure.